There is a small opening here. You put it here, and you close. Then you take it and you put it in the mouth. This is a dry powder inhaler. This is a meter dose inhaler. To use that capsule, I need this device. This is the inhaler, which actually, when you shake it well, press, you can see the medicine there going. Keep it here. Keep it in the mouth. Press here.
Hi guys, this is Minitpan and you're watching HealthSite.com. Today we have with us Dr. Chandrashekhar H.B, Pulmonary Medicine, BMJ Hospital, Bangalore. Hi doctor, how are you?
Hi Mini, how are you doing?
I'm doing great and I hope things are keeping well in Bangalore as well.
Yeah, greetings from Bangalore. We're doing fine, except that the fire has spreading, Omicron virus. It has devastated us for so long, and it has made everybody's life topsy-turvy. And I don't know when we are going to totally recover from it.
That's true. I think all of us are sort of suffering because of this danger that's going on in the country. Having said that, since we're talking about COVID, Omicron, how has it really affected asthma patients in particular?
Definitely, the COVID, I would put not Omicron, you have Delta, Omicron, all those variants. So earlier we used to have the seasonal flu, influenza. It's become a part of our life. In 2010 years back, we had the swine flu, H1N1. All these are all basically respiratory viruses. Any respiratory infection or a virus will trigger or worsen an asthmatic symptom. That is there, it's not something new. But what COVID has done is that it's a little more severe in terms of aggravating the existing problem. Those people who had a very mild problem or in between they're free for a couple of years, they come back with a worsening problem. The problem which would go away, the symptoms which would go away in a week or two would take longer to subside. Those who are well controlled, moderate to severe asthma also actually experiencing worsening of their symptom with the COVID. In fact, studies have shown those who have uncontrolled moderate to severe asthma are at a risk of catching the virus, one, and they also suffer more in terms of hospitalization, ICU care, etc. So this is the picture. So it has impacted the asthma. Not only asthma, it has impacted any chronic respiratory diseases.
Okay. But doctor, the air is such that we are surrounded by magnum of diseases at the same time, currently specifically. So people are also facing breathing issues in general in terms of, how can one really differentiate the symptoms as to, is this a COVID symptom, or are we generally facing any breathing issues, or is it the asthma that's, taking its peak? How can one really differentiate?
So if you really look at asthma, we have multiple triggers. One is like indoor or outdoor. Somebody who's cleaned a house or exposed to some paint, smells, renovation at home, handling old blankets and things like that. That as an indoor trigger. Outdoor, of course, air pollution, everything that we know. These are the triggers of asthma, including the viral, especially children. Virus is the one which triggers asthma, not only children, in adults as well. This we know for many decades. Similarly, coronavirus, in asthmatic, you have two things. They also have increasing breathlessness and cough, which is a common symptom of corona as well. But in addition, they have this viral respiratory symptom like sneezing, running nose, stuffy nose. And in COVID, of course, in the earlier phases, we used to say loss of smell, sore throat, abdominal symptoms, which are not common in asthma. Unless we test, most of what we are facing in this third wave is anybody is a suspect who's coming with cold, running nose, feverish, and also whether they have existing asthma or COPD, we have to suspect because we don't know who is suffering, who is not, unless we do the test. We will not know. Purely based on symptom, I cannot say this is no COVID or this is only asthma. So asthma is there, we have to treat it. In addition, any asthmatic coming with a fever and upper respiratory infection, abdominal symptom, we have to check for COVID to make sure they don't have. So by and large, if they don't have the fever, not much of a sore throat or abdominal symptom, you think it's mainly cough and wheezing, then we're likely to say this patient has asthma. But based on history alone, physical, I cannot really say COVID is not there. So sometimes we take a call and take a decision depending on how they are feeling, whether to test or not. But the way things are going, we need to probably any respiratory upper or lower, we need to maybe check the testing, do the testing for the COVID. Yeah.
So, you being a pulmonologist yourself, if we really need to tell our viewers as to how one really should use inhalers. So, what will be, a pulmonologist guide on using inhalers?
It all depends. What happens is most of them, in fact, we had to reinforce. In the first visit, we teach them how to use the inhaler. And when they come up for the follow-up visit, we also teach them. But if I'm a very busy doctor seeing some 50 and I will not have enough time, so you need to delegate it to somebody within your team if you have a team. Teach. So there are a lot of videos available by a lot of pharma companies how to use the inhaler. So there are two types of inhalers we use for asthma. One is a dry powder inhaler. Another is a DPI and a meter dose inhaler. The typical example of a dry powder inhaler is that it comes as a capsule, like here. So what we do is we take the capsule and there's a small opening here, you put it here, and you close. Then you take it and you put it in the mouth. You tilt the neck a bit. This is a dry powder. This is like a capsule like this. It goes in, you actuate it, you inhale. So this is the dry powder inhaler. So there are advantages and disadvantages for both the type. The other one is this is a meter dose inhaler. This is a capsule, is a dry powder. This is a dry powder inhaler. This is a meter dose inhaler. To use that capsule, I need this device. This is the inhaler, which actually, when you shake it well, press, you can see the medicine there going. So you shake well. So there were two ways of using it. One is directly shake it well. There are two schools of thought. One, they put it in the mouth, close the lips around this, press, inhale. So that means you need coordination, pressing the inhaler, inhaling the medicine like a. I typically give an example. If you put a straw in some juice, you suck, similarly press, inhale. So that is one way. Then also on the school, because this inhaler delivers the aerosol, it's like a gas at 100 kilometers speed. So it impacts the throat. Some people you say, keep the mouth open, keep it away, press, inhaler. So the two techniques, but most of them they keep it. I prefer personally, in Western world, you say give the preference to the patient, but I believe in using a spacer because this will increase the medicine which gets into the lung 8 times more. If the inhaler delivers 10% of the medicine into the lung, this will increase it by 8 times more. That means 18% of this medicine gets in. So I shake it, keep it here, keep it in the mouth, press here, inhale, hold the breath, breathe out, breathe in. So breathe, so the medicine comes into this chamber. So you breathe out, breathe in, breathe out, breathe in. 4-5 times, again you press. So this is one press is one actuation, we call one puff, one actuation. Will deliver a specific amount of medicine, whether it's a dry capsule or this aerosol. It's called meter dose inhaler. Specific amount of medicine goes into the spacer. So this what happens, once the medicine comes, it is traveling at a very high speed. It decreases speed. And we have another chemical in this medicine called propellant. So you have active medicine and a propellant, they are coupled together in the meter dose inhaler. When you use this medicine comes into this, it lowers and the propellant evaporates, you get more of active molecule into the lungs. So that's the advantage. So increase the same dose, you get more medicine into the lung, that is where it is needed. But in COVID time, what I found was this is called as a breath actuated, it's automated. So this is one device which I really like because like online consult, you can't teach them the spacer. So you have to shake it well, keep it in the mouth, no pressing, nothing here. In this inhaler, I have to press this one. Here I need not have to press, it is actuated, the breath actuated. You put it in, you inhale, hold the breath, breathe out, close it again, take it out, inhale. So this is called breath actuated inhaler. Ciplas brought it to synchro breath. So this is wonderful because You don't need to train a patient. He just has to open, keep it in the mouth, inhale, that's all. No pressing. People who are little old with tremor, they can't actually have not enough strength to press this. So this is a very ideal tool. So this is how, these are the basic types. One is a dry powder inhaler, meter dose inhaler, with spacer, and a breath actuated inhaler. All the three of them work fine, but in COVID times, when you don't want this thing to go, this is one of the best ways, because this comes, the cap is fixed to here, cleaning is not a problem. Here you have a different cap. So the people tend to forget dust may settle. So this actually does a wonderful job. So you have spacer inhaler, your dry powder inhaler, you have a breath actuated inhaler, all of them works fine. So the bottom line is, whatever their doctors have prescribed, medication is the most important thing. Just like diabetes, just like blood pressure, you need to be on the medicine on a regular basis. That is your insurance. Otherwise, you will end up paying a lot of premium by getting into the hospital if your asthma is not under control. So my message to all the patients is, just like the way, don't expect a cure from asthma or allergy. Take the medicine, it can be controlled. Nowhere in the world anybody can cure asthma. Nobody can cure diabetes. Nobody can cure blood pressure. So what we have is control. Next best is the medication I give, you should give you good relief from your day-to-day activities, a good quality of life. At the same time, medication should not cause long-term side effect. That's the message. So patients are worried that it will cause addiction, so on and so forth, only for asthma, but they don't question it for diabetes and blood pressure because of the alternate systems of medicine claim that they can cure. But once they understand it cannot be cured, it can be perfectly controlled. I think once they are on regular medication, their quality of life improves. Most of the asthma medication do not have, years together, if they use also, do not have any long-term side effects.
Well, I think that's a good sum up, Doctor. I think this has been really insightful for all our listeners. So thank you for joining us today.
Thank you. Bye. Take care.
Thank you. Thank you.